Welcome everyone to the ABCD and data mapping webinar, the third in our series provided by Data Across Sectors for Health about asset-based community development. And I'm Celestine Emberton. I am a program manager here at Data Across Sectors for Health on the Illinois side. And yeah, coming from Chicago. So nice to see you all here. And I will share the presentation. There we go. But yeah, if you're just joining, feel free to share a little bit about yourselves in the chat. And if you have any technical issues, you can message Scarlett Gleason and she will help you out with those. And yeah, I'll just start introducing our speakers today. So first we have Beenish Kamran, who is with Data Across Sectors for Health at the Michigan Public Health Institute, where she focuses on research, evaluation, learning, and translation. She believes in the power of relationships and communities rooted in deep understanding of historical context and cultural values. And she grew up in the Southeast and currently resides in Mississippi. We are also joined by Indigo Bishop, who is a Clevelander, facilitator, and strategist specializing in sustainable development. She has worked in philanthropy and affordable housing, and today she is a program officer at the St. Luke's Foundation. Indigo has dedicated her career to building wealth and health in BIPOC communities and leveraging existing assets to strengthen her city. Ron Dwyer-Voss is a founder of Pacific Community Solutions Incorporated, a training, consulting, and technical assistance company focused on working with community-based initiatives, nonprofit organizations, and local governments. His work focuses on asset-based community development and organizing, community engagement and mobilization, and participatory evaluation, all for the purpose of shifting power in communities. And we also have Darryl Answer, who was born in London, England. He is currently a co-pastor of New Community Church and founder of Verge Solutions. Through Verge Solutions, he provides consulting, training, and facilitation for organizations and communities in areas of entrepreneurial mindset and community development through an asset-based lens. In addition to serving in a consulting role, Darryl works in neighborhoods as a mobilizer and connector of residents and institutions around their shared vision of power, healing, and abundance. So, yeah, welcome our speakers and thank you for joining us today. And I will hand it off to Beenish.
All right, thanks, Celestine. Yeah, like Celestine mentioned, I focus on DASH's research, evaluation, learning, and translation. And on the next slide, you'll may see something familiar. Some of you who have attended previous webinars in the series have probably seen this visual of DASH's current iteration of the DASH framework, which is a translation of our learnings from awardees, many like yourselves, who we've had the honor of supporting over the last decade and learning with. And so this framework, just as a refresher, calls out the key areas that we've seen community collaborations take into consideration and develop in their journey to building and leveraging shared data ecosystems to transform inequitable systems. And we know typically data collection is controlled by outsiders or institutions with resources, power, and access to funding. And if data is only being collected, analyzed, and interpreted by a select group of folks, especially those outside of the community, there's a good chance that the story told about the community will reflect to the interests of that group rather than the interests of the community members themselves. And so this is kind of a driving force, and the power behind data is a reason why it's so important for community members with lived experience to be involved and engaged and lead and co-own the process of collection and analyzing and interpreting data. And it really allows folks to be able to lean into the power they have to tell their own story And this is why we emphasize equity throughout the data cycle in our framework as well. But however, for this work to take place, there's some key foundations that we've circled here in red that really set the tone and approach moving forward. So we can go onto the next slide to kind of zoom into my personal favorite part of the DASH framework, which are these core foundations of the work. As the slide states, it starts with community. And we really believe that people represented by data, particularly, must play a meaningful, interpretive, and decision-making role in the data sharing process. So personally, I like to think of these as kind of core values in action that set the tone for and should be considered throughout the work, so throughout the areas of the framework. And these values in action consist of three specific community foundations as the cornerstone for equitable and successful data sharing. They are shared vision, trust, and shared power. And so Dash's asset-based learning journey with ABCD staff has really reinforced this concept of data as a community asset. And the lens and approach that ABCD takes intentionally leans into supporting the power that already exists within the community. And so this approach really allows community collaborations to begin with human relationships, develop a vision that is shared across partners, especially community members with lived experience of systems, and to deepen trust in partnerships along the way. And I'm sure many of you joining today can speak so much more on what this looks like from experience, what it looks like in practice. So this next slide shows a relationship between Dash and ABCD and highlights the various sources of community data that comes from first knowing the assets in one's community. So leaning into kind of this asset-based community data and bringing those with lived experience of the data into the data collection, analysis, interpretation of it, it really ignites this pathway for community information to transform systems from perpetuating harm into systems that support community health, well-being, and thriving determined by the community. So today our goal and hope is that to help you improve health equity in your community, to support you on this journey and be a thought partner and recognize data as an important asset. When ABCD organizers like yourselves understand that importance of data, powerful community-driven initiatives will result. So yeah, now I'm happy to pass it on to our ABCD staff. They'll be guiding us all in some reflection and even share examples of what this looks like in action. And feel free, Ron, Darryl, Indigo, if you have anything that you want to add to this slide or visual, anything to highlight, feel free to share.
Beenish, thank you. Yeah, I think did a great job laying a foundation for us. The next few moments that we'll be together. I saw some of you say good morning. It's afternoon for me. I think, Ron, you may win. It's like breakfast time. We're right. All right. So good day to each of you. We're so glad to be with you all. Again, Beenish, thank you. Celestine, thank you for getting us kicked off today. We want to take some time for you to get to meet one another. So we're going to take about 10 minutes in very small groups and breakout, probably in pairs, to just have some conversations with one another. We're going to do a quick check-in. So if we can go to the next slide, you'll be able to see some of those questions that you'll be able to answer. So share your name and location again, even though we've done that in the chat, but now we can put a face to it. And then 2 questions is, how do you currently map data in your community? What does that look like for you right now? I mean, do you currently have a sense of shared vision, trust, and shared power? Okay, so going back to the foundations of community as Beenish laid out for us, in this DASH framework, in ABCD work, in creating power and systemic sustainable change in our communities, there has to be this sense of shared vision, trust, and shared power. So we're just going to take 10 minutes for you to discuss that, regardless of where you are on this journey. You're at the very beginning. You would say that you are an expert, which I don't know if that's really true. We're all learning. We're all trying to figure this thing out. But just wherever you are on this journey, just take a few moments with your partner to discuss. So I believe Scarlett is going to send you into breakout rooms. But I want to hand it over to Indigo, who is going to walk us through our first story of community data collection.
Hi, everybody. What is today? Happy Tuesday. I'm going to jump in. Well, I think we're going to share slides again, but I'm going to jump in with an example, a story of a project that I worked on last year. I have a side business in addition to being a program officer and working in philanthropy. I also do community engagement trainings like this, but I also lead community engagement processes. And so I did that for 2 parks in the city of Cleveland last year. The city put out an RFP to hire a landscape architecture firm to redesign 2 parks. They had budgeted $3 million to do these investments in the parks, but they didn't have a plan for what they wanted to redevelop or what they wanted to do. And for once, a city actually decided they wanted to slow down and put some money behind engaging the community to find out what the folks who use the park actually want to see at the park. So they hired a landscape architecture firm to do the planning and the design, and that firm hired me to come in and talk to people, basically. So this is a little story about how we collected that data and used it so that to advocate. I use that to advocate for what the residents want rather than what a few polished professionals might think is most important or most needed. And this is kind of reflective of a story that's in the workbook. I don't know how many folks have read it or looked through that DASH workbook on evaluation. But in there's a story of a park development. I forget where it is in the world, but it was a very similar story where a city wanted to redevelop a park. There were 2 baseball diamond fields that were in bad shape, and they had heard that there was some drug exchange, some drug usage, drug selling at the parks, and they wanted to find a way to. The professionals thought that redeveloping the baseball diamond would mean that more people would come to the park, making it safer and less drug exchanges happening. But when the teens in the neighborhood found out that this was the plan, they kind of raised the alarm and said, hey, we don't know anybody who uses that baseball diamond for baseball, even though that was what the permits were pulled by a couple groups that played baseball there. And that's why the city was going off of that strategy and plan, because they just looked at who had pulled a permit to use the park, not actually investigating who was using it outside of the permits. And so the teens volunteered to collect data in a really strategic way. They decided to post up at the park at different times of day and had a data collection sheet that they all used to talk to people who were using the park and ask them things like, how often do you come here? What do you use the park for? What would you like to see in the future here? And what they discovered was that rather than baseball, most people use the park for soccer, and that there were some moms who used the park specifically because there was a bathroom there and their young kids could use the bathroom while they played. And so the teens suggested or advocated for the changes that were reflective of what the conversations that they had with their neighbors. And that's essentially what I did. So I went into these 2 parks, the neighborhoods around these 2 parks, really focusing on, I usually in my business focus on like a 0.25 mile radius around the center of what's going to be redeveloped. And created a sheet with one-on-one questions, which are basically the learning conversations that we mentioned earlier in this workshop series. Came up with those questions and a schedule. A lot of those questions influenced what came from there, what I designed from there in terms of engagement. So I asked things like, where should we meet? Who else should I be talking to in the neighborhood about these parks? And even kind of fielded or tested certain survey questions with them before building the survey. So that's kind of the way that I do it. I start off with one-on-one conversations based on who I know in the neighborhood or who I'm connected to who might know other people in the neighborhood. We designed these flyers, 2 different flyers, very different vibes for 2 different parks, also based on the partnerships that were involved. One of the council persons was heavily involved in one of the parks and wanted to design the flyer to reflect her branding. And so that's the first flyer in green that you see. There's a lot of words on it. It's a little wordier than I would prefer, but basically has the same information. Hey, this change is happening. There isn't a plan yet. We want to hear from you to determine what the park should look like. And so it's an invitation to a couple workshops that we had. I usually like to do a couple informal pop-ups or walkthroughs through the park with the neighbors who I've done one-on-ones with and the ones who they've suggested that I talk to, followed by a couple workshops, either virtual or in person or both, usually a hybrid. And so these are the flyers promoting those pop-ups and the workshops and the survey. So we created these flyers, we door knocked. I hired some kids from the neighborhood to help with the door knocking and the flyering, and had some informal conversations on porches. These are pictures of the walkthroughs at the 2 parks with the neighbors from the one-on-one conversations or learning conversations. And everyone we had talked to and invited from flyering. And so we facilitated 2 in-person community workshops, 2 virtual workshops, 4 pop-ups, where we had food and snacks and the surveys, printed surveys, and also the flyers where people could use the QR code to complete the survey in their own time. It was just much easier for data collection, but not as strategic for an older population. So you have to be careful of what data collection method you're using and what user you're working with. But we did that. We did giveaways. We did flyers. We had, I think in the previous picture, there were foam boards with a map of the park and little trinkets and cutouts of things that could be infused into the park or added based on the budget. So folks at the park there was an opening ceremony at the beginning of the summer for the pool that was at one of the parks. So we already knew there was going to be a bunch of people there. There was going to be press. The mayor was going to be there. And we thought that would be the perfect opportunity to do one of our pop-ups. So we did a pop-up there and engaged, I think, about 30 folks. Anyways, long story short, on the next slide, you'll see this is kind of the results. So I synthesized the data from these discovery calls, from the one-on-one conversations, from the qualitative data that I collected when we were door knocking, informal interviews, the comments that I recorded through the walkthrough, talking to neighbors in the walkthrough, going through the parks, and then also all the data collected and the comments from the 90 neighbors who were engaged in those workshops, and then finally from the survey also. So this was our attempt to get the most comprehensive understanding of what the users of the park and the people who are in closest proximity to the park actually want. And it revealed a lot of really useful information that the city wouldn't have come across on their own naturally. And so once we synthesized that, I created a report, and the recommendations were basically from one of the parks that they were pretty happy with it as it was, except for that there was a huge mosquito infestation every summer. And so for 4 months out of the year, 3 or 4 months out of the year, the park was not usable. People had to actively stay away because the mosquitoes were so bad. And so rather than pour in a ton of money into a new baseball diamond or fixing the basketball courts or things like that, the majority, or not the majority, but my recommendation was that the majority of the interventions that the city implements there and the the landscape architecture firm implements there really target that mosquito infestation problem, because if you can't get to the park comfortably and stay there comfortably, people aren't going to use it. And that investment, whatever it is, there was one suggestion to do a splash pad where this water element might stimulate more mosquito growth and development. Rather than do something like that, they decided, or we recommended, that they focus on mosquito intervention. And then the other park, the council person there was not very helpful in terms of the engagement and actually discouraged door knocking. And rather than defer to what the neighbors wanted and what we were hearing from folks who use the park, he was firmly pushing for pickleball courts, even though not one resident that I talked to mentioned pickleball at all. And even though pickleball courts had been installed in the neighborhood the year before, in very close proximity, he wanted pickleball courts. So often we know that that's how decisions are made for the places that we live and even the institutions in which we sit and work for. And so this was an active engagement to counteract that kind of status quo method of determining what should happen in the community. And so the long story short is that that $3 million investment in those park improvements will be put to the highest and best use according to what the people who live there and use the park actually want and prefer, meaning that those investments will be used and beneficial to the community rather than wasted, because so much of the time big government dollars are spent in ways that for interventions that either don't achieve the desired result because they haven't engaged the community, or can actively be a negative investment and impact the community in a negative way, which is the worst possible outcome. So this is just a quick example from my work. Those developments haven't happened yet. I believe this summer the construction starts, so I don't have a final ta-da story of how it turned out. But in that workbook, that example that they provide, they mentioned that that story actually did come full circle, and the park became the jewel of the neighborhood. And the story that was told about what the park was and who it was for was drastically shifted when the teens were allowed to take that leadership responsibility and role. And so I'm going to pass it to Darryl. He has another example to share from his work too.
Thank you, Indigo. Yeah, I just have a brief example to share on how you can engage youth in your data collection. So a little bit of background on my community where I live, my zip code specifically, in my city, the whole metro, my zip code has the lowest life expectancy, according to our health department. So there's a lot of data around the deficits, what's wrong with our community. And so for 3 years now, I've worked with a group of youth from my neighborhood and from my community to discover the gifts and the assets and try to create solutions to those challenges, but through an asset-based frame. So to try and bring health, bring healing, and also uncover the wisdom. So we started this initiative 3 years ago, actually in my living room. So that first picture on the left is my dining room. So I would gather kids. They named themselves the Game Changers and create their own logos. So that's also on the back of t-shirts. And we would roam the neighborhood literally and discover the gifts of neighbors. It's now grown. We have about 50 kids and we're in 2 different locations. The next slide shows the questions that they themselves created. So we create this space for the youth, help them understand an asset-based approach to even thinking about their community. That was through a lot of neighborhood walks, challenging what they saw, challenging what they focused on. And then we create these questions. So what's your name? How long have you lived in a neighborhood? What are your interests? What do you like to do? What's your job? What's something you'd like to learn? Something you could teach? What do you hope to see in a neighborhood? And what words of wisdom would you like to give us? So these are, again, questions that they created. That picture in this slide is actually from about a month ago on Miss Rose's front porch. Miss Rose, she saw us walking by and was like, no, you all need to come have a conversation with me. She then ran inside and got her whole family. And she was like, I want a t-shirt. So anyway, Miss Rose has like become a huge fan of the work, so much so that about 3 weeks ago, she had us all just walk over to her house and just hang out, meet her mother, who's 90 years old, and just listen to stories of the neighborhood, and even found out about the organizing history of our neighborhood, which we didn't know about. So again, just doing this work to shift the narrative. The next slide shows exactly champion. That's exactly what she calls us. It's like, I'm your champion. So the next slide is just some of the data that we collected that first year. So again, this is a community that has, we have our challenges. Homicide. There's, I think Friday night was the most recent. Two houses down from me, there was a shootout. So a lot of things do happen, but that's not all that we are, and that's a part of this asset-based framing. Is when we do this work, is we're trying to expand how we define community, right? When you look at a place, it's not just what's wrong with it. When you look at a people, it's not just what's wrong with it. And even though a lot of our nonprofit work comes from that, comes from good intention, but we can also have these unintended consequences when we only focus on like the brokenness and define people from that place. So just looking at these two documents, I'm sorry, it's really small, but you can see these are the things that people, again, this is just one summer of youth walk, just literally roaming the neighborhood. We didn't knock on doors, we just roamed the neighborhood, roamed the streets, had conversations with people on front porches. So things that neighbors can teach, there's things that neighbors are interested in, and then there's things that neighbors want to learn. So we just had a great time. And then once a month, we'll do what we call we're doing one this Sunday. We do community connections where we invite the folks who were interviewed. We invite the kids, their families, their friends. We celebrate all that we've discovered. And then we ask the question, what can we now do with all this information, with all this data, with this abundance of wisdom and knowledge in our community? What can we now do? So we're actually getting ready to start a Spanish class because we had a number of people who wanted to learn Spanish. And then we came across a party in the neighborhood and interviewed everyone. And one of the ladies was like, I want to teach Spanish. So like, okay, cool. We got students for you. Right. So that's right. Just another example of gathering data, but again, in a way that's focused on shared power, vision, and focused on beginning with the community. So with that, I'll hand it back over to Indigo, who's going to walk us through a couple slides.
I'm going to go through these pretty quick, but this is another tool that might be useful. I find it very useful for after the mapping process and the data collection. What I've found is that in talking to community, you'll hear a million different, not a million, but many, many different ideas for what is most important in the neighborhood and what should happen, like what interventions or what projects should be started or added to make things better. And it can be great and exciting to have a full list. And it can also be a little overwhelming to figure out where do you start, because you can't do all the things all at once, of course. And so this is a tool that we use to help narrow down who should be involved and what to prioritize. Each of these this is an example, I think from Sarasota, Florida, where they were talking to teens and folks in the neighborhood who serve teens about solutions for an issue or to solve or brainstorm around an opportunity to improve things for teens. And so you can see a ton of ideas here, but the columns to the right are really focused on what can be done quickly. So inside, like with minimal resources, with what we have at our disposal right now, and I'm talking about we from the community standpoint. So what the neighbors have access to and the assets that they have at their disposal, which of these interventions could be done quickly within a few months with what you have. That's the inside column. And then the together column is really about what is a mid-range initiative or like a 6 month to a year project that could be taken on with the assets of the neighbors and a little bit of help from an outside institution or two or three, however many partners you need to bring in to accomplish the thing. And then the outside component is really about long range initiatives that might take 2 years to accomplish or multiple years to accomplish and require significant like financial, material, human resource contributions, or other like technical assistance from institutions. And so this is where outsiders and institutional allies could really like lean in and use their power and resources to help the neighbors with whatever initiative is most important to them. But then all the way to the right is that last column, which is really important. It's about identifying low priority, medium priority, and high priority initiatives. So the idea is you decide who should be involved and to what extent based on how long and how big and heavy of a lift each project is, and then prioritizing which are most important. So obviously you would start with the highest priority, a medium or a high priority project. And ideally, if you're just starting to organize, or this is a first initiative or first thing that the neighbors are doing together, you'd ideally also pick a project that's low-hanging fruit, that's easy to accomplish, and that you could build relationships through and use as a stepping off point for other projects and initiatives. So something that can be done on the inside with just neighbors, which also means if it's just something that just neighbors are capable of doing, that means the institution should not be involved. So if your institution is doing a thing that the neighbors can do for themselves, that can be damaging. So it's good to pay attention to that. And I think the next slide actually goes over a few planning questions that you could use to also, if you're more of a, right brain thinker, is more like creative artsy. There's that left brain. Anyways, one of these strategies is better for right brain. One of them is better for left brain. You can use both. But these planning questions can help you kind of suss out where your institution is doing for the community when they should be doing with community, and where your organization might be actually like enabling the community really to not solve its own problems, which not every community can solve all of its own problems, but the majority of communities in where we live, we have more resources at our disposal than we like to think. And so these are a couple questions that are reflective of those insider together and outsider columns and help you suss out what you should be doing and what you should be doing less of as an institution or as an organizational ally. So hopefully these are helpful. Happy to talk more in the Q&A. That might lead to good discussion about other tools that you all are using also. But these are a couple of ABCD tools that we use. I think I'm passing it on to Ron to go over some more details about the data and evaluation.
I think given the limited time, we're going to jump to our breakout discussions.
Okay.
And go ahead and go down another one. And there's some specific questions here, but you go down another, there you go, about how your community efforts inform your evaluation process and how an ABCD lens can influence your data mapping process. But I'd like to open that up a little bit more and just encourage you in your groups to talk about what you've heard today that you might be able to use and what you've done in your own practice that you found useful that others in your group might be able to benefit from. You know, today we started with Beenish sharing a framework and the importance of starting with community and all the data that exists in community assets. We heard about community planning process on a park from Indigo that used data to influence how a community amenity was redesigned. We heard Darryl talk about engaging youth and looking at the community through the lens of youth, and then engaging youth in the actual data collection, and looked at some tools as well. So there's a lot there. So what we're going to do is break out for 7 minutes and give you a chance in groups of 3 to talk about what you've heard that might be useful, as well as share your own promising practices with each other.
Right. I think we're all back. We have just a couple minutes, well, really 1 minute to hear back. But anybody who wants to share, I would love to hear from you and what you've heard and shared with each other. There's some time for Q&A at the middle of the hour. I don't know which hour it is where you are, but in the next few minutes. But if anybody wants to come off of mute or drop in the chat one takeaway from a conversation that you had, either a tool or a methodology that your partner used that you want to share with the group, or that you've used that you want to share, feel free to do that now, either verbally or in the chat. One thing that I just wanted to add in that I noticed or wanted to mention is that anyone can do a survey, anyone can do a focus group, anyone can do an interview. Those aren't inherently ABCD evaluation tools. I think that's obvious. I think you know that. But the ABCD component comes in the details of how you do those things and how you implement those things, like who you ask, how you ask them, where you ask them, what questions you ask them, and how you phrase the questions. All of those details are really what make it an ABCD process, an engagement process, and make it valuable. So I just wanted to drop that in there. I don't see anything in the chat, or I'm not hearing anything. Oh, I see a hand. Jerry, you want to add in?
Yeah, hi. This is my first exposure to ABCD. Even though I've been getting the newsletter for a few years, it's finally sunk in apparently. But I'm really excited about the stuff I've been learning. And my biggest, I believe the biggest application that could be used, and I'm curious if any of the projects that I'm going to be researching through your site, but if this methodology has been used in the criminal, legal, and behavioral health system intersection, because that's where I work, and we try to work with counties to help them help the behavioral health people talk with the criminal legal system people and divert people into programs and services rather than jail or prison. And it seems that the few years I've been involved there, and I'm only speaking for myself because I'm not one of the facilitators, but I write the reports and I do a bunch of research, and I have a bunch of my own lived experience. But we very rarely get in the jails and ask people what they think and what do they need and what do they want. And it goes so bad as in LA County, I just found out if you have a mental health issue, you have to wear a different color jumpsuit. So everybody knows the people that have a mental illness, and that's the people you target essentially. Or it can just reinforce the stigma and make those people more victims and it's just candy to a predator. So we have just such a huge need in to reform these systems and just completely redevelop them. So I'm really excited about this methodologies, and I'm going to be learning a lot more about it. Thanks.
Thanks for sharing, Jerry. I'd love to hear more in the Q&A, but I'm going to pass it to Celestine to close us out. And then in the next 30 minutes, we can talk more about that.
Yeah, thanks, Indigo. Yeah, thanks everyone for joining. And here's the contact information for all of our presenters. And thank you so much for just sharing your knowledge and expertise with us all today. And this slide deck will also be sent out via email after with the recording of this presentation. So yeah, but if you don't receive it, let us know and we will get that to you. But yeah, this is the end of the presentation, and we can start the Q&A portion.
Jerry, I just put a name in the chat. Somebody may want to, oops, he's gone. Oh, there he is. You might want to connect with Bob Francis, who affiliates with the ABCD Institute, and you can find him on the website there. He did a lot of youth work and which then led him to do more work with those folks who, engage with the incarceration systems. So he would be worth reaching out to. And then I know Joe Erpenbeck, who's also on the site, has done a lot of diversion work, not so much from jails, but from services for folks with various disabilities, doing some asset inventories first and finding ways for them to engage in community that turned out to reduce their need for services and increase their measure of dignity. So I think both those folks came to mind right away. Rebecca Pauls, who with Joe is in Canada, has done similar work with people with disabilities. I don't know, Darryl and Indigo, if you think of other folks who've engaged those systems.
Those are the same people I was thinking, at least through the Institute. So yeah, definitely reach out to them. And you can go on the ABCD Institute website and see all of our stewards. The information's right there.
What institute was that, Darryl?
ABCD Institute.
Okay, good. Yep, I just registered today.
At DePaul, yeah. And then Tom Dwyer, who I think is still on there, is doing all kinds of work, has a background in ABCD and evaluation, and for the last 10 years has been doing all kinds of work around reforming the incarceration system. And he's always a great conversation.
Put the link in the chat for it. And Jerry, you said you just signed up, but for anybody else who's interested in the Institute, ABCDI, Asset-Based Community Development Institute, you can see more on the website.
And yeah, do we have any other questions or maybe insights from the breakout groups that people would like to share?
I have a question. When we were just speaking of signing up with the Institute, what were we referring to? I think Jerry had mentioned he signed up on something, and then we were.
I know you can sign up for the newsletter and the emails, but there also, I don't know if it's live yet. I don't think it's live yet, but soon there will be an opportunity to join as a member, or there's going to be a membership structure where you can have access to certain things based on what type of membership you sign up for.
Got that. Okay, awesome.
Yeah, and I was referring to that ABCD Action. It's called ABCDinaction.org.
Oh, okay. And that's more of like a community of practitioners who pose questions to each other and respond to questions and share resources.
Correct. Okay, yeah. Thank you.
Add that in the chat too.
I guess just an observation. So my name is Amanda Nochi, and I've been practicing ABCD for the past 10 years, a little over 10 years. And yeah, so in our city of San Antonio, we've kind of stepped into the jail system. We have a couple of programs within the health department, but then also through the county that addresses, or it tries to address some of the comments that you guys had made regarding recidivism or anti-recidivism work. So it's just very interesting that it seems like there is a group consciousness kind of happening in all of the U.S. because I've been in other groups and that always seems to come up. So I don't know if it's because of the funding, like just the funding cycle is funding a lot of these projects and that focus, or just if, again, as a society, we're all focusing in on that. Like, but I think it's awesome. So thank you guys for your work.
All right, Eric, Becky, anything useful today for you all, or Adria?
Yeah, I mean, I'm still just kind of on the very tip of the iceberg of what ABCD is and does. Definitely a lot more research to be done and how I can connect it and spread it to the rest of my organization. While I see quite a bit of what we're already doing from the examples that were given, maybe just some other finer points on how to be much more effective with that. So thank you. I love the interactive too. This is really helpful.
Yeah, I guess I concur. I did like the interactive part, got to meet some people and hopefully, continue to connect. And so it's just my introduction to ABCD, my first time to a webinar like this. And so I definitely am really interested in the manuals that you guys have. Right now I am working on like a use case component of our project where I need to collect qualitative and some quantitative data from users or potential users for a new data warehouse that we're doing, a statewide data warehouse. And so my users sort of are spread across the community. I have a homeless system staff that I want to interview. I have healthcare staff that I want to interview. We have healthcare, like health plan organizations. And then we also have like our state Medicaid agency. And so all of these players are going to be interacting with this data warehouse. And I really need to better understand what their utilization of the warehouse would be and what would that look like and what would improve or encourage them to use it. What kind of data do they want to see at the end of the day? So this is, a really good timing for me to come across this organization and the materials that you've provided. I think it fits really well with kind of where we're at in our program implementation plan.
Cool. I put the link in that'll take you to the page with the manuals.
Awesome.
Digital version, prints, English and Spanish are the two languages we have.
Thank you.
And yeah, through this Dash process, if stuff comes up and you want to talk more about what you're doing, we have these office hours. I don't know when the next ones are, but
yeah, definitely. That would be really good. I think, right now I'm definitely trying to use as many resources and get as much information as I can and manage it as it's applicable to the program and where we're at. So since we're in the beginning stages, this building a foundation is really important. So I appreciate this information.
Yeah, and I'd recommend exploring some of the insights and insights from communities like similar to yours or folks doing similar work on Dash's website as well. So I'll put that in the chat too. There's a lot, and feel free to reach out and to any of us to kind of, if you're looking for something specific or guidance.
Yeah, well, thank you.
Yeah, we'll help as well.
Yeah, I did sign up for the newsletters and stuff. So thank you guys.
Can I ask you a couple questions?
Yeah.
Well, one is, are projects like this typically funded by government? And the second question is, I noticed that you do a bunch of funding, and usually I'm a mad researcher, so I'll learn a lot more. But I'm curious, does Dash fund initiatives that are developing programs and systems like this that could be replicated across the country?
Yeah, I think in many ways we have, and then we have current programming going on, and we've shifted to Melissa, who's not here with us today, can speak a lot more with this, but on this. But I'll say that we definitely are, as a kind of a more of a re-granting organization, we do try and support and work towards, different approaches to supporting folks who are kind of in these early stages and really focusing on like applying lenses, with ABCD especially, and that's something we've done in the past, and maybe there can be opportunities in the future too. So I would definitely recommend reaching out to us through our website or emails, and even connecting with Melissa, whose email may not have been there, but you can get connected with Melissa as well, just to hear a little bit more about that.
Right, thank you. It's one of my biggest frustrations with government is just, it just seems like they would just rather the community kind of stay away because they got it, like, don't worry, we'll take care of it. And whenever we give feedback, it's typically always, feeling like we're being patted on the head and, thanks a lot for your advice. And we're going to go do what we were going to do anyway. And it's always been frustrating too that when we do go do these community forums every year, we go back to the community and say, okay, what do you want to tell us? And we don't reflect back to them what you told us last year and what we did and what worked and didn't work. And maybe we could adjust our thinking. And does anybody have any ideas? We don't ever do that. We just, every year starts over like a new year. So when you go out to the community and say, okay, we're here to see what you think, the community just yawns and, they have no interest in the pizza, or whatever is being offered. And so I think there's a lack of continuity from year to year, in the community. And I think the community would be a lot more engaged if they would just get more frank information about the shortfalls or the challenges and the gaps that are experienced.
Yeah, one thing I'll emphasize too is like Dash has been on this iterative journey of like changing and learning and changing as we have over the last, decade, and especially more recently in the last couple of years, like literally leading into and listening to who the communities were funding and being intentional about how to think through what organizations, what compensation of community members looks like and how we can support that and that level of flexibility that's needed when it comes to funding, and really kind of doing some pushback ourselves too on making space for those conversations and that process. So a lot of the work and the programs that we have going on, those are the conversations we're having and continuing to iterate and learn from you all, like what works best. And so it's a journey, and so we're happy to lean in and learn alongside you all. I'm sharing the kind of a link just to give you an idea of current programs and that we have going on now, where we are kind of applying some of this equitable grant making and trying to meet folks where they're at and include community members along the way too.
The areas I've seen where people have been able to get local funding to do this kind of work is when a local jurisdiction says they want to do community engagement, but this is my editorial comment, they don't take it seriously enough to do it themselves, so they're going to outsource it and have a grant for somebody to come help them engage the community. And what I've seen is folks then respond to that RFP with an ABCD approach and say, we'd be happy to do your community engagement, but here's how we would do it. We'd turn it inside out and do it the other way around. Rather than engage the community in your agenda, we'd engage the community about discovering its agenda and then be the link between the two. And some communities, to their credit, have stepped up to that and said, okay, yeah, let's do that. That's another way to get the work funded. But you run up against, a lot of crap, but you're trying to change systems. So that comes with that territory. I see Becky's hand up.
I was just going to say, when Jerry and Beenish was talking about kind of not looking back at what you've done, a lot of our, with my organization, is working on a lot of that CQI, that continuous quality improvement, of looking at what we've done. Did it work? And then should we continue doing that, or do we need to go back and look again? And then that just really helps wholeheartedly with the whole child and the whole family. Because again, we're more early childhood. We're definitely more that birth to age 8. So really looking at what families need to thrive for their family, for their child, and how that works within their community. So definitely, as you were talking, Jerry, about, we always talk to these, the community, but we don't look at what we did last year or ask what they did last year. And I feel like that's really something that's changing, as I've been in early childhood all of my career within my area. And everybody's like, oh, it's just another squeaky wheel. Like, you're just gonna do the same thing that you did every 5, 10 years. You're something. What makes you new? What makes you different? Why should I listen to you? And I think by owning up to it and saying we're here in every tiny town. I was just at an event in a very small town, 50 minutes from where I live, doing a story hour, talking to parents about what they need in their community, because it's different than where I live or where a bigger city across the way. So, and I definitely think owning up to it and being involved, being a part of the solution makes it much more believable for the people.
This is Adria. So as I'm looking at some of the website stuff that you guys sent, I am realizing that this program funded the program that I'm running now through your LAP grant.
Oh, wow. Yeah.
Or whatever this is, not necessarily a grant, but the LAP funding in 2021, 2022. Like I can see your grantee map here. So you funded the Arizona Housing Coalition, who was the administrator of like the RFP. And so Laurie got selected as the administrator for this data warehouse program, who now I've become the program administrator for. So I'm the first staff on the program. So thank you for your contribution. It is why I'm here today.
Wow, thank you for still being in our orbit with us.
That was awesome to make that connection.
That's neat.
I did a right when COVID came, and and they came out with the vaccines. I did a analysis of if I was in a community of color, from a zip code. I think it was something like 37 clicks or keyboard actions to get the thing to refresh so I could schedule my vaccination. But I did it from the wealthier communities, and it was like 7 clicks. It was unbelievably disproportionate. So I went to the board of supervisors, and I announced that I was in a protest and I'm not going to schedule my vaccinations because it's so easy for me to schedule. And then I went to my family, and they recommended what if I get sick and end up hurting somebody or killing somebody? So it was drilled, so I went and got my shot, but I kept going to the council meetings, and they did not react well to that, but it was true. I mean, and I showed everybody how to do it, and here's all the screenshots, and it was just amazing how things like that can, or data can really reflect realities, and especially for something that important.
Yeah, Jerry, just to respond to that, that's actually something that I've been thinking about, and going back to what I was saying about use cases and why this is important is that part of my questions that I'm sort of thinking about asking is around, the use of technology, right? Because I want this warehouse to be useful, and how many clicks do you need to go through to find the information that you want? Because it is actually really important, like mosquitoes at a park. It seems like a simple thing, but there's easier solutions to solve larger problems. So I think that's a great point, actually.
Yeah, thank you everyone for sharing. It's been really great and enlightening, and hearing everyone talk to each other has been wonderful. We do have a few more minutes, I think, for another question or two before we end for me, it's 3 p.m., but it might be a different time for you all.
It's lunchtime.
Okay, on that note, I think we're good to end, and thank you all for joining and joining the conversation. And yeah, I hope you stay connected to Dash and to the ABCD Institute.
When's
And
how do folks sign up for office hours if they want to?
yes, so we will be sending email signups about that. And yeah, just respond to that email and we can set up a time for you all to come to the office hour sessions that are upcoming. And our next webinar, if you have not signed up for it yet, is on August 6th at this same time. So hope to see you all there too. And that'll be our last webinar in the series. So yeah, but great talking to you all and meeting you all, and have a great rest of your day.
Thank you. Have a good one, guys.
Thank you all.